Louis. And now at this time, we're going to get ready for our programmatic content to get your brain ready. We got your body sort of situated in room temperature. And so now we're going to get your brain ready for what we're going to talk about today. Ms. Laura Metters is our clinical social worker who's been working in the Integrated Memory Clinic. That's what IMCC stands for, Integrated Memory Care Clinic. And it's a clinic for people who have Alzheimer's or other cognitive impairment, for whom there's really not much to do except manage their chronic medical illnesses. So living with Alzheimer's or related dementia is really a chronic or terminal illness. And at some point, medications are no longer effective in treating whatever the cause of that problem is. And most of us who are affected with Alzheimer's or related dementia need a lot of help and care just managing our day-to-day illnesses. So the Integrated Memory Care Clinic is a one-stop shop where you meet with a medical provider, an advanced doctor of nursing practice or a nurse practitioner who manages your primary care. If you have social needs, there is a social worker there who can help your family address what other needs you may need, such as directing you where to go for in-home help, custodial care like sitting services or housekeeping services, but also maybe emotional or other social support services that you may need. That may be something like transportation, that may be something like utility support. So we do have social workers embedded in the Integrated Memory Care Clinic caring for people who are living with Alzheimer's or related dementia. If you have a diagnosis of dementia, you can come to this clinic, but don't expect to be diagnosed. We manage in this clinic. We're not diagnosing you. We're not treating you for a whole lot of other things. If you need that level of care, you probably need to stay under the care of a medical provider, a medical doctor who can manage your specialty illness or your specialized illness, as well as your primary care need. So at this time, we'd like to introduce Ms. Laura Metters, who is now director of the clinic. She's no longer just a social worker, and I think it's more than being just a social worker. The staff, the crew, the people who are employed in the Integrated Memory Care Clinic are very, very committed to the patients and the populations that they're working with. And the thing that I like about the Integrated Memory Care Clinic, I don't have any worries about sending patients there because I know that instead of a robotic phone call, you're going to actually hear from an actual person who takes your call, records your messages, and talks to you one-on-one. So we have to have different models of care for people who have different levels of need. And it's important to recognize that once we reach an end stage with Alzheimer's or related dementia, there is no further intervention that is required that is even appropriate for people in that stage of illness. What is required is that we continue to manage people's chronic medical care needs, social networking needs, and emotional care needs. And it's not just for the person living with the disorder, but for the family as well. So at this time, it is my pleasure and privilege to introduce to some of you and reacquaint some of you with Ms. Laura Metters and the Integrated Memory Care Clinic here at Emory University. It is run wholly by nurse practitioners. You will not see a medical doctor, you will see a nurse practitioner. So let's get that part out of the way. That's who you're going to see. So, Ms. Metters.
Right. Thank you, Dr. Parker, for that introduction and for the opportunity to speak to people on BrainTalk Live today. It is my pleasure to be back. Some of y'all may have heard from my colleague, Carolyn Clevenger, in the past. She's also the founder of Integrated Memory Care. And so we are excited to be able to share more with y'all about our progress and our clinic model, as well as some of what we have been doing. Are y'all seeing my presentation slides or any slides?
Not yet.
Okay, let me try that again. Can you see it now?
There we go. Yes, ma'am, you got it.
Okay, perfect. Sorry about that, guys. So what is integrated memory care? As Dr. Parker gave a great introduction to what it is and what it is not a little bit earlier. But integrated memory care is a combination of primary care services with dementia care services, as well as supportive services for the caregivers, all in one clinical site. So as much as possible, we really do try to coordinate and quarterback care for the individual living with dementia, in order to make the person who is living with the diagnosis and those care partners and family members who are supporting the person living with the diagnosis, hopefully make things simpler and easier to navigate, at least make the healthcare system easier to navigate if we can reduce the amount of times that people are bouncing around to seeing different specialists. It is often the case that different medical providers are looking at problems from their own specific lens, but dementia affects how you manage lots of different types of conditions. And so the IMC is really looking at things from a holistic perspective to say what makes sense in the light of where we are in this disease process and what makes sense with what is in line with the patient and family's goals of care as well. So how is integrated memory care different than usual care? As Dr. Parker mentioned earlier, our clinic model is unique. There is not another primary care clinic exclusively for people living with dementia in the Atlanta metro area. There is not another primary care clinic for people living with dementia in the United States, as best we can tell. We are it. So we have a unique perspective and delivery model. If we look at this slide, most people experience healthcare like this woman on the left, right? So you would have your primary care provider. If you are lucky, you might have a geriatrician or a geriatric specialist who is leading your care. Most people, if they are lucky, and if you are engaged with the Emory system, you may have a neurologist who has worked up your dementia diagnosis and may or may not see you for that ongoing treatment. You may have a palliative care specialist or that sort of is treating how do we manage symptoms, how do we improve quality of life. And then you may have to interact with organizations in the community to find any sort of support for you yourself as a caregiver. You may have to rely on the Area Agency on Aging, the Alzheimer's Association, support groups through churches or adult day programs. Not that there is anything wrong with the services that those individuals are providing, but it's likely something that the caregiver is having to seek and find and try and see if it works on their own, and trying to pull together based on what they're hearing from Facebook or neighbors about what's good or not. And some people may have the option to hire a navigator or an advocate for them. Often we think of these individuals as aging life care managers, or there may be some sort of care coordinator with the AAA or various programs, health insurance programs that people may have who may be able to help you. But often these are unique clinic models. They are often sort of not coordinated and not working together. And for patients of the integrated memory care clinic, we really do our best to combine all of these services under one roof. So we've got the geriatric providers who are specialists in that. They also have expertise in managing those dementia symptoms and progression, really focusing on how do we improve the patient and family members' quality of life. You have a team that's quarterbacking your care. And we do have a social worker who is full-time, in addition to myself, who is able to help families navigate some of these challenging circumstances to know when to access care and what type of care you may need to access along the journey. If you think about a patient who is living with dementia who also has, let's say they have uncontrolled diabetes and they're having some psychological symptoms related to that. So they're just a little bit more irritable. They're just not quite themselves. In the typical model on the left, who should the family member call? Is that a call to the family medicine specialist? Is it a call to the geriatrician? They might say, well, this isn't really what we do. This sounds like it's your diabetes needs to get under better control. So you should probably call the endocrinologist. They're the person that's managing your diabetes. And then you go to endocrinology and they say, well, I shouldn't be called about this. I mean, we can better control your diabetes, but the problem that you're having is really these behavioral symptoms that you're having. And I don't deal with behavioral symptoms. I'm just an endocrinologist. You should probably see your neurologist. And the neurologist says, oh, well, this is not really what I do. This is behavioral symptoms. This is maybe related to dementia. I know you have dementia, but you're really agitated and you're having these extra behaviors. So I think you need a geri psych specialist at this point. And so the family member probably has spent a very long time trying to figure out how to manage this problem, and sort of getting the runaround from all of these different specialists and sort of knowing who's on first, who do I call, where do I go first. Within integrated memory care, it is all one clinic model. And we do our best to manage those chronic conditions in-house to avoid the back and forth and the confusion with people. So we do have geri psych nurse practitioners as a part of our team as well. So when those sort of behavioral symptoms may show up, we have experts who can manage that. We also have experts who can manage patients who have lifelong histories of schizophrenia or bipolar disorder and now have developed a type of dementia that often becomes very complicated with medication management. And so one team can handle that instead of trying to bounce back and advocate as the family caregiver between the two. Let's see here. I think I skipped some. So what makes the IMC unique? Again, we are combining that specialty dementia care and primary care. We have an interprofessional team, so there are nurse practitioners like Dr. Parker has mentioned. We do have collaborating physicians, but most of our patients will never have an appointment with the collaborating physicians. They're there to support the nurse practitioners as they quarterback care for our patients and families. We have registered nurses who can do that clinical triage, medical assistants. We have clinical social workers, and we have geri psych nurse practitioners who are a part of the team as well. We try to do our best to partner with patients and family members to provide care that aligns with what matters most to the families who are going through this journey together. And we bring the full resources of Emory Healthcare. We have access to the patient portal, access to that integrated memory care. We have the services through Emory Healthcare, but we also have direct access to the IMC team. So instead of calling the call center, you can call our team directly and we can make sure that that message gets to the right person. We learned pretty early on that it was going to be very difficult for patients and families to explain this new model of care to the call center to be able to make sure that the patient's needs were being addressed. At the time, we had a lot more shared providers, and so it was just very confusing, and we found that covering that ourselves just made a lot more sense, both for us as a team and for our patients and families. They can call and know that they are speaking with somebody who is going to get the message to the right person. So why does the IMC exist? It exists basically because family care partners told the founders of the clinic that the current health system was not really working for them. We're saying, these other illnesses that my loved one is experiencing may have some impact on dementia symptoms, but nobody in primary care or my specialist seems to understand how dementia works in sort of the day-to-day life. I'm tired of explaining to my providers what FTD means, how that presents itself. So integrated memory care, our nurse practitioners are really adept at sort of managing these symptoms through the lens of this person has limitations to what they can do in their day-to-day life as far as management and initiation, as well as sort of understanding that the goals of care may be different now than they were before the diagnosis as well. I also want to spend some time talking to you today about the IMC and community program. So we do have a clinic program. I think some of y'all may have heard about this in the past. The clinic has been open for about 10 years. We opened in 2015. And we're coming up on our 10-year anniversary. We have moved from the Brain Health Center to 57 Executive Park. So we are just around the corner from the Brain Health Center and EP6, from where a lot of the research activities occur. But we have also launched another new model of care that we call IMC in Community. And so this is another unique program that is not available anywhere else in the country. And so I'll tell you a little bit about what this is. We kept getting feedback from patients and families. We would work with them, we would talk about their goals of care, and then they would get to a place in the disease progression where their loved one would need to move to an assisted living for various reasons. And then the family would come back and say, we would like our person to continue with the care at integrated memory care, but it sure is difficult to get mom, dad, spouse back to the physical clinic. Both for the care partner, this was very time consuming, and sometimes it was really disruptive to the person who was living with a diagnosis. And so we would like to continue to come to clinic, but we have this option for an in-house provider who is not a dementia expert, and in many cases may not be a geriatrician, although there are some geriatricians who provide those domiciliary services, and Emory has an excellent program for just geriatrics that rounds at assisted livings. But families were really missing that dementia expertise as well. And so we started a program called IMC in Community that will allow us to continue to see patients who are current clinic patients or people who are newly interested in our program in select senior livings throughout the metro area. It keeps the patients and care partners at the center of care and decision making, so they still have access to that social worker, they still have access to geri psych providers, they still have access to that unique model of care, but it allows the integrated memory care team to coordinate more closely with the senior living community. We have a partnership between the communities that we have decided to provide services with. There's no financial relationship there, but just an agreement that we want to work together in order to achieve the best possible outcomes for the patients and the families who are working to support them as well. And so the integrated memory care community program sort of completes this total picture of comprehensive care within the larger team so that we can continue to serve patients until they reach the time where they are appropriate for hospice or another higher level of care. The one piece of integrated memory care and community that is very unique to our program is we have a role called the dementia care assistant. The dementia care assistant is not a home care assistant. It's not a certified nursing assistant. It is not, these individuals are not providing direct hands-on care. What they really are going to do is provide one-on-one engagement with the person who is living with the dementia diagnosis. So they come out once a week and provide an hour of sort of face-to-face services. And what they do depends on what the goals of care are for that person who is living with the diagnosis. But they really are critical at sort of improving the mood, improving the quality of life for the individual who is living in the assisted living. And they're also a really critical member of the care team as well. So they are not trained clinicians, but they are really in tune with the individuals that they are serving. And so they can pick up pretty quickly, Mrs. So-and-so is not herself today. She was very difficult to rouse. I couldn't get her to engage in anything, and that is not like her usual behavior. They report that back to the team, and then they're able to sort of triage and assess things faster than they would have if they waited another month or two for that regular visit. They're able to sort of assess, there is something going on. The room is way more cluttered than normal. Again, sort of picking up on those visual cues that we may miss if we are not in somebody's house and in somebody's space in order to pick up on that. So they're implementing tasks from the nurse practitioner, working on those goals, developing individualized activities based on the stage that the person is in. As well as sort of what are those hobbies and interests that they have had for a long time, and how can we adapt those activities to be able to fit where they are and their current strengths. And then all of this is documented in my chart for people to be able to see as well.
Excuse me, Laura, can
Yeah.
you tell us what NAV means? It's a question in the chat and I'm like, I'm not seeing it anywhere. What does NAV mean?
NAV.
In blue star on both sides. I don't know. Is it navigator? Did you use the term
Oh,
navigator
yes.
anywhere?
So I think that navigator, if I go back to that slide with the woman, whoops, this woman, that was an abbreviation for navigator. So somebody to sort of help you figure out how to navigate either the healthcare system or those community resources as well.
Thank you. Thank you for that clarification.
All right, thank you for helping with that blue star. That was, wasn't sure what I had been talking about. So who is eligible for particularly the community program? And I can talk about clinic as well, but for the community program, you do have to have a diagnosis of dementia. You have to reside in a senior living community that agrees to allow the program. You have to agree to change your primary care provider to integrated memory care. And then there is a monthly fee for the community program as well that is in addition to the billable services through a person's health insurance. People who are not eligible for the community program are people who are already receiving hospice services, or there are some senior communities who also have long-term skilled nursing services on site, and those individuals are not eligible for the community program either. For clinic, you do also have to have a diagnosis of dementia in order to establish care, as Dr. Parker mentioned. We do not diagnose, we provide those ongoing services. So you have to have that diagnosis of dementia on the front end and be able to provide some sort of documentation that this has happened. You do not have to reside in a senior living community in order to participate in clinic, but you do have to live within certain zip codes in order to participate. You do have to be willing to change your primary care provider to integrated memory care, and that is really for the safety of the patient and family. So if you have a long-standing primary care physician that you have been going to, and you want to continue care with that primary care physician, you probably should. Like Dr. Parker said, this model may not be for everybody, but you do not want to have two people who are trying to quarterback your individual's care. It could lead to medication confusions, medication errors, or just if one provider doesn't know what the other one is doing, it could put the person in a really dangerous position. And so it is best to just have one quarterback. That is why we ask that you change your care to IMC. And for clinic, there is only the services that are billed to insurance is the fee that you would pay. There is not an out-of-pocket fee for clinic. So again, the cost for the community program, not for clinic, there is a $400 a month fee that includes all of the services that the community program provides that are not covered by insurance. So as you can imagine, the dementia care assistant is not covered. The supplies for the dementia care assistant are not covered. Mileage is not covered. We have a phlebotomist that comes out and will collect labs. That trip fee for the phlebotomist is not covered. So there's a lot that we try to sort of bundle in this $400 a month for people who are participating instead of receiving a bill each time something is done. And then there is also health insurance that will be billed for those visits with the nurse practitioner at the assisted livings as well. People often ask, where is the IMC and community program? These are the assisted livings that we are at currently. I think we're in about 17 to 20, depending on sort of how quickly some other agreements become signed. And as you can see, we are primarily inside the perimeter with the program, or sort of outside of this 400 corridor as well. And so these are where communities have expressed interest. And our focus at this point is really trying to grow the programs in the communities that we have partnerships established with at the moment. I have a short video that I am not sure if I can share or not, that will, I think, do a better job than I can to demonstrate the importance of the community program. How am I doing on time, Dr. Parker? I don't know if we have time to share this or not, but this is at the
You've
end.
got plenty of time.
Okay, I'm gonna quickly stop sharing and see if I can pull this up. And share it with the sound so that y'all can hear from other team members on integrated memory care and hear from some of our family care partners about the program and what it has meant to them. So bear with me just 1 second while
While you're searching, can you answer this question?
Sure.
Because there are going to be some changes in the political administration and funding with Medicare and Medicaid, is this program going to continue or expand? Will change in the administration and policies affect the funding of this particular clinic?
I mean, it certainly could, but at this point, we do not have any plans to change our operations. We have not heard of anything concrete that would impact our day-to-day function. So I think if there are changes in the administration or Medicare reimbursement that impacts the IMC, it will impact Emory Healthcare and other providers significantly as well. I don't think that this is so unique that it would be the only one whose operations would be impacted. Hopefully that is not a problem we have to worry about there. Let me see if I can share this. Dr. Parker, let me know if you cannot hear me when it starts going. Hold on, that is not working. It's trying to annotate things and
Marissa, can you, we saw it. You hadn't started it.
it's not letting me start it, but I think I can now.
Dementias due to Alzheimer's disease and other disorders are probably the most feared diagnosis that people think about as they're aging. IMC exists first and foremost to improve the quality of life for people living with dementia and their family caregivers. I had my own hunch that systems of care like the emergency department, hospitals, were not really set up to meet the unique needs of people living with dementia. And so I talked with various family caregivers to tell me how they would want care if they could just scrap the whole thing and start over. And then based on their input, I designed IMC to function within the realities of the healthcare system as it currently exists.
I feel like what makes our program special is we care for the whole family. My grandmother was a dementia patient, and I saw how important it was for her to not only have the support of her family, but also a care team around her. We have a team of social workers, registered nurses, nurse practitioners, physicians, dementia care assistants, all working together with the same goal in mind of providing the most supportive patient care experience.
When you're dealing with people with dementia, they want to feel loved and cared for, and that's the way I feel IMC makes my mom feel. My mother's dementia care assistant is Lucy, and she is fantastic. She really gets to know her clients' patients, and what I really like about it is as they finish up their visits, I get a full summary of what they did together, whether it was play Scrabble or bananagrams. It not only brings joy to my mother, but it brings a smile to my face every time.
It truly is a family situation. It takes a community to manage this because my husband, who is in the latter stages, it's changing dramatically, and without IMC's care, I couldn't do it.
Even though we see patients about every 3 months in clinic, a lot of things happen between day 1 and day 89 between visits. So we created the IMC and community program to bring the excellent primary and dementia care and psychiatric care to our patients who reside in senior living. And we also created the dementia care assistant role so that there's ongoing companionship so that we can catch any problems that arise as soon as they pop up and address them early.
It's really rewarding to watch someone who's just moved into maybe a memory care unit, to see them slowly come out of their room, slowly begin to engage with the community. So being able to watch that process and know that our team has played a role in it, it really means a lot.
I think to myself every single day, the support that is so available through IMC is truly priceless. I want to personally thank the IMC program on behalf of myself and my husband, and on behalf of all families that are dealing with this.
Great. There are a couple of questions in this chat, and I want to clarify one of them. The film and some of your previous answers answered this, but there's a question in the chat that talked about Kaiser Senior Advantage and whether that matches with the Integrated Memory Care Clinic. I know you don't have to be an Emory Healthcare patient, so I think we have a lot of people listening who aren't necessarily Emory Healthcare patients. So how can they come? How can they come?
So we do not require a referral from a physician in most cases in order to establish care with integrated memory care. Kaiser is sort of a closed loop healthcare system. And so we would have to have a referral from Kaiser in order for a person to establish care with the IMC. And because the IMC is also a primary care provider, it just gets very tricky. So I don't know that the answer is no, but it is not uncomplicated and in order to establish care if you have Kaiser, because Kaiser tries to handle everything internally. That being said, if you are a patient typically at a Piedmont practice, Northside, Wellstar, and are interested in this model of care, you don't have to have the referral from the Emory physician. You can call our main number and submit the information for our clinical director to review. And if you meet eligibility criteria, we would be happy to have you establish care as a patient. For the clinic, we have a wait list that is longer than we would like. So we are scheduling out, if you were to call today, it would probably be the end of April before we will be able to get a person in for a new patient appointment. The community program, we can get somebody within like next week typically, because we have more availability in the community program. That's our newest and the one that we are growing. But again, that does not require you to be an Emory patient previously in order to sign up.
Just for clarification, if we can go back and find the slide that shows the different senior living communities where the Integrated Memory Care Clinic operates, that would be appreciated. Again, as Ms. Metter says, you don't have to be an Emory Clinic patient, but there are community services provided in residential communities, not hospice communities, but in living communities like the Arbor Terrace. So there's her list: Arbor Terrace Crabapple, Arbor Terrace South Forsyth, Benton House Decatur, Holbrook Decatur, Kingsbridge, Orchard at Brookhaven, Park Springs, Peachtree Hills Place, Sunrise of Buckhead, Sunrise of Decatur, La Corso, the Georgian Lakeside, the Solana of East Cobb, Village Park, Alpharetta, and Milton, and Addington Place in Alpharetta. Somebody take a screenshot so that you can see these. If your community is not on this list, it's safe to assume that the Integrated Memory Care Clinic is not operating out of these particular residential communities. Doesn't mean that they won't eventually. You might want to bring this project to them as an alternative, but you can always come to the Integrated Memory Care Clinic here at Executive Park in Decatur / Atlanta. So again, that's where the community program is operating, i.e. off of the Emory campus or out of Emory, not in Emory facilities. There's something in the chat that says, what about the validation method of dementia care? I have absolutely no idea what that is. Do you know what that is?
I do not know what that is. I don't know if that is, I know, is it, Esther Klein may have, developed that, but I am not sure if we're talking about the same thing without more information.
Okay. Good answer. Okay, last little question and answer here. I think if we can put up, I know in our chat, we have put up the email links, but is there a direct phone number that we can have for people to call? Many of our listeners like to make phone calls. And as I said, the thing that I like most about the integrated memory care clinic is you don't get to talk to a robot. You get to talk to a person who actually answers your questions.
That's right. Let me share one more slide with y'all. So this QR code, I'll maybe share two. This QR code is something that we have developed. You can hold your cell phone up to it, and it should pop up to go to a link where if you are interested in the community program specifically, you can enter your information and somebody on our team will contact you to tell you more about that program and discuss your eligibility. If you are interested in clinic specifically, this is our main number. It's that 404-712-6929. So that is our direct number. You will get either somebody who has somebody on our team. If you do not get somebody, they are on the other line handling calls from somebody else. So leave a voicemail and we will give you a call back.
On that note, when you talk about, let's say once you're enrolled in the program and you're an actual patient, if a family member has a question about care, you will do things like renew medications online, right, for patients. Let's just say they do a home test and they say that they have tested positive for COVID. Would you prescribe and send in the Paxlovid without them coming in?
So I can't tell you how our nurse practitioners would absolutely manage every case, but that is something that would typically be within the realm of our practice guidelines and what our nurse practitioners are comfortable with. So it is typically a conversation to say what makes sense, how can we address this fastest. Our goal is not necessarily to bring people in every time they have a problem, but how can we troubleshoot that at home as well? What other things can we try before we try medication that in the case of COVID, and it may not work, we may need that Paxlovid, but are there other things that can be done to manage some of those typical symptoms of dementia besides medications as well? So our nurses are excellent at sort of triaging those clinical concerns and figuring out a plan that's going to work for that specific patient and family.
Thank you. Any other questions for Ms. Metters? You've actually done really, really well. I had quite a few questions. I'm sitting here looking at anything else that we have here. And for our audience, this PowerPoint, this presentation will actually be available on our YouTube channel within the week. The PowerPoint, I'm not sure about the PowerPoint. So somebody on the back end, can you tell me about the actual PowerPoint?
Yes, Ms. Meadows, is it okay if we send out the PowerPoint you showed today? Sure. Yep, so it will be made available within 24 to 48 hours along with today's recording, sent directly to your email by our communication specialist. You're on mute, Dr. Parker.
Anything else you'd like us to know about the Integrated Memory Care Clinic, Ms. Metters?
No, I think we're excited to be able to serve people who are living with dementia in the Atlanta metro area. We've been doing this for a while. We're not new to it, as Dr. Parker said. So I feel quite comfortable recommending the care of our nurse practitioners to provide that ongoing care and management, not just with dementia, but with those other chronic conditions in primary care as well. As a patient-centered medical home, we are often focused on quality measures and have compared how we're doing to other departments within Emory. And we are sort of right in line with where everybody else in the Emory practices are. So you will be in good hands with our nurse practitioners. I dropped the website on the School of Nursing side. We are a joint partnership between the School of Nursing and Emory Healthcare, which makes some things a little bit wonky sometimes, but it makes other things helpful. This community program would not be possible without the support and the partnership with the School of Nursing. Their website is also a little bit easier and faster to update. So we will always have those links to sort of what is the newest and most current on the School of Nursing website for integrated memory care as well.
Thank you. Just for clarification, just to remind people, the Integrated Memory Care Clinic provides all of the primary care services that you would normally get by going to a separate primary care provider, your geriatric psychiatrist, if you have psychiatric diagnoses that go along with dementia, but also neurologic disorders. So in the event that you need a medication titration, the nurse practitioners will do that. If they need to confer with your neurologist, your psychiatrist, that can be done, that is done, right? I don't want them to think that they're completely bereft of the services of their specialists, because you confer very much with them.
I would say we work very closely. I think, again, it sort of depends on who is driving the ship for the problem. And as long as everybody is clear about who is driving the ship, then that's okay. And it's our job to quarterback that, as long as we are kept in the loop with who those other specialists are that the family may be interacting with. But we certainly have patients that are seeing other specialists in the Emory system, and that is okay. We have patients that are seeing specialists outside of the Emory system, and that is okay too.
And you'll get to see them if you need to. You'll be referred back to them if you need to. But the idea behind the Integrated Memory Care Clinic is to keep you from popping in and out of different clinics and exacerbating and making worse the day-to-day experience of persons living with dementia. And a lot of times you just need a familiar face, a simple adjustment. You don't need to go to the emergency room, as an example. That's one of the things that I thought was wonderful about the Integrated Memory Care Clinic. There was no longer a need to send somebody to the emergency room for something simple. And that's why it's important to establish your care in a patient-centered medical home. And the Integrated Memory Care Center and Integrated Memory Care Clinic does that for you, as do some very comprehensive geriatric and primary care practices, but that's not available to everybody. The objective is to be able to move through your life seamlessly without having a whole bunch of people communicate information or be misinformed sometimes. So with that, I want to thank you, Ms. Metters, for taking the time today. I hope that people who have need and family members who need coordination of care or simplified care, if you're living with chronic, progressive, disabling neurologic disorders, there's frequently not a cure for those disorders. What we have to do is manage their day-to-day medical needs and maintain. So that's what the Integrated Memory Care Clinic does, tries to eliminate the stress of running from clinic to emergency room to clinic here, there, and everywhere. So give them a try. As a physician who's referred many patients to the Integrated Memory Care Clinic, my families are very happy being seen there. So please consider it. And again, it's something that's available here in Georgia, not necessarily available yet in other parts of the country. So thank you, Ms. Metters, and Crystal, I'll turn things over to you.
Thank you, Dr. Parker. And again, thank you, Ms. Metters, for giving an amazing presentation today. Very, very informative. And thank you all for tuning in today for another episode of BrainTalk Live. We will